cytokines. Today, I will share with you my screen so that you can see and learn about interferons and basic differences between humoral and cell-mediated immunity. And then we are going to summarize all that has been done in this particular class. So when it comes to interferon, let me just share my screen with you. So when it comes to interferons, you get to see that interferons, they were first discovered by two Japanese scientists, Nagano and Kojima from Japan. So it is a virus inhibiting factor. It was discovered in the year 1954. It was also discovered by Isaacs and Lindenman in the year 1957. So they were these were the four scientists who had discovered interferons in 2 different years altogether. Now they are again a family of cytokines. They're involved in alerting the the immune system, so that whenever there is any kind of viral infection to the host cells, then the interferons help in triggering the immune systems. They have antiviral effects, but they are also a key influence to the kind of cellular responses that can be seen in the body. So their actions affect both the innate immune system as well as the adaptive immunity. Increases in the expression of major histocompatibility class 1, that is interferons alpha and beta are involved in this particular function, and they also help in increasing the natural killer cells activity. So type 1, that is INF alpha and IFN beta, is secreted by virus infected cells, while type 2, that is interferon gamma, is mainly secreted by T cells and natural killer cells and macrophages. They interact with specific cellular receptors, promote production of secondary messengers, so that secondary messengers or whenever they are triggered, they involve in signal transduction pathways. So this leads to the gene expression or antiviral expression, expression of basically antiviral and immune modulatory genes that are present. So this is all about the interferons. And when you see their functions, they have an anti-tumor effect. They inhibit cell growth. They inhibit and stimulate antibody, that is B cell production. They stop or the T delayed hypersensitivity. We will be learning it in the next chapter. Then it also inhibits blastogenesis and DNA synthesis. They have the effect of expressing the T cells. Basically, they go trigger the T cells so that T cells do their work or function. Then they also help in inhibiting or potentiation of the NK cells, and they induce the antibody dependent cytotoxic activity, and also then the stimulation of phagocytosis. Then they help in adherence to the tumor cells, so the tumor cells are then are recognized, and activation of different pathways such as complement pathways can take place. Expression of MHC1 and class 2 antigens is taking place. Potentiation of different kinds of reduction in neutrophils, bacterial proliferation, increasing in the histamines, and promotion of differentiation of erythroblasts, neuroblastoma cells, chemotaxis for neutrophils. All of this is taking place because of interferons. So this is all about interferons. As you can see, again, they have given type 1, type 2 and a different, the history behind it. I will share this particular screen with you so that you can always, have a look at it. So this is the function of interferons, INF beta and alpha. They are secreted by the virus infected cells, whereas NK cells is with the help of the type 2, that is immune or gamma interferons. So interferon therapy is also there, which is there in the treatment of hepatitis, cancer, different kinds of cancers, and INF beta is used in improvement of condition in multiple sclerosis. INF gamma for chronic granulomatous diseases, or in osteopetrosis, that is overgrowth of the bone. This is different from osteoporosis, so please don't get confused with it. So it is also used in lupus. So in case interferons, IFN1 type 1 is inhibited, then it helps in the reduction of autoantibodies in lupus as well as in HIV. So this is all about interferons. Now, I will start with humoral and cell-mediated immunity. Let us just see it as a kind of differences. So you will be able to know. So there are the adaptive immunity consists of two types, that is humoral and cell-mediated, and it generates different kinds of specific antigen responses or immune responses. And T cells and B cells perform the cell-mediated and the humoral immunity respectively. And when it comes to humoral immunity, you get to see that it is mediated by antibody molecules that are secreted by the plasma cells. So it is an antibody mediated response. So extracellular spaces are protected by this humoral immune response. So antibodies are produced. That is, B cells recognize the antigens or pathogens that are in the blood or in the lymph. This happens in this. What happens is antigens bind to the B cells. Then B cells stimulate the T cells or the interleukins. In most cases, what happens is both the antigen and the co-stimulator, whatever is there, that is, B cells, they both are required to activate the B cells. So this causes B cell proliferation. Then they proliferate, produce the B cells, that is, produce the plasma cells. And these plasma cells secrete the antibodies with identical antigens, which are specific to the antigens that are present in the body. Then the antibodies are released, circulated, and then they bind to the antigens. Then B cells also produce the memory cells which are present. These memory cells provide future immunity against the same antibody if it comes again. Now, in the case of cell-mediated immunity, it is because of direct action of the T cells. So this is there in MHC markers, and including cells such as the foreign particles, pathogens, tumor cells, transplanted cells, all of them come over. And then the T cells that are there present, they act against this intracellular microbes and bacteria, and also they help in B cells. So that if at all B cells are involved again, what happens is antibody response is taking place. So in case of cell-mediated immunity, you get to see that in the cell-mediated immunity, the immunity is because of cells or APCs, that is the antigen-presenting cells, which already show the foreign antigens. So they bind to the T cells. Now, interleukins, that is, they are either secreted by the APCs or by the helper T cells. They help in activation or stimulation of the T cells. Then, if MHC1 and antigens are displayed on the plasma membrane, then the T cells proliferate. They produce cytotoxic T cells, which destroy the antigens that are displayed. Now, in this, again, MHC class 2 and other antigens that are displayed on the plasma membrane, the T cells proliferate. They help in production of the helper T cells, which release cytokines, which release interleukins, which stimulates the antibodies that bind to the antigens, and then they stimulate again NK cells, macrophages, which in turn destroy the antigens. So this is about the cell-mediated immunity. You can just go through it. Again, definition, the different kinds of mediators involved, that is there. The components involved in the case of humoral and cell-mediated immunity. In humoral, it is B cells, T cells, macrophages. In cell-mediated immunity, it is helper T cells, cytotoxic T cells, NK cells, and macrophages. Pathogens are again, given over here. And how do they recognize their pattern and the kind of pathogen that is being recognized? And is it with the antigen or the epitope that is involved? And then, you see the antigen detectors. They can be the phagocytes, antibodies themselves. In the case of cell-mediated, it is receptors and MHC molecules that present they are the APCs basically, which present to the T cells. And in case of antigen binding, B cells produce the antibodies and antibodies bind to antigens. Whereas in the case of cell-mediated immunity, it is T cell receptors on the cells. They bind to the T cells, which in turn bind to the antigens. Then the processing of antigen, how it is done, is given over here. And then you can see the detection of the antigens, the binding of the antigens, the processing of antigens, and whether there are any kind of receptors involved. In humoral, it is B cell receptors which are involved. In cell mediated, it is T cell receptors which is involved. And accessory receptors include Ig, immunoglobulins, gamma, beta, Fc receptors, CD40, CD21. Over here, it is CD4, CD8, dimer of epsilon chains, and you have CD28 integrins. All of these are involved. Types of T cells are CD4, that is T helper cell, CD4 plus, whereas in cell mediated, it is both CD4 and CD8 and T cells that are involved. And when is the onset, whether it is rapid or delayed, what is the kind of result? So antibodies are secreted, cytokines are secreted, protection against bacterial or viral. This is protection against fungus, virus, intracellular bacterial pathogens. And what kind of hypersensitivity reactions are seen? And what is the role in organ transplanting or grafting? Immunity against cancer, tumor cell immunity against tumor and cancer cells is seen in cell-mediated immunity, and a plasma level of the antibodies is seen for assessment of B cells, whereas it is skin test for the development of delayed type of hypersensitivity. So this is all about the interferons. So, and this after the interferons, it is the cell-mediated and the humoral immunity that we have just seen. Now, when it comes to the summarization, we have already seen the complement system, and then we have seen the MHC class, major histocompatibility class 1 and class 2, and where it is exactly located on chromosome 6. And then, in the humans, it is known as HLA genes for that matter, and they're divided into 4 classes, but we usually study about class 1 and class 2. And cytokines, we have seen, they're secreted by the lymphocytes. Formerly, they were known as lymphokines, and they are secreted by those monocytes and macrophages, which are known as monokines. And interferons were discovered by Japanese scientists as well as Isaac and Lindenman in 1957 and 1954, and they are responsible for viral interferences. And when it comes to the humoral and cell-mediated immunity, you have already seen that T cells help us for protection against microbes and viruses, whereas B cells for the antibody responses against microbes basically. And humoral immune is because of the antibody molecules secreted by the plasma cells. So it is known as antibody mediated response. Whereas the extracellular spaces give rise to the humoral immune response, and this is known as the this is where the antibodies are produced. So when it comes to the immune system in our health and disease, you get to see that we have quite a bit of, if at all there is, an over triggering of the immune system, what is it exactly going to lead? When there are when there are any kind of antigens or pathogens inside, the triggering of an immune system leads to the killing of the microbes. But if at all it is happening without any kind of trigger as such, and without any kind of pathogen or a microbe involved, it is known as a hypersensitivity. So the concept of autoimmunity arises because of it. It was described as horror autotoxicus by Paul Ehrlich. So it resembles a normal immune response to the pathogens, but then in this case, it is because of either self-antigens or autoantigens, because of which it causes some kind of a disorder inside the body. So we have a term for that. Basically, it is hypersensitivity. The ability of the immune system to respond inappropriately to any kind of antigenic challenge is called as hypersensitivity. So in this, what exactly happens is immune responses are present, they get exaggerated and inappropriate against one particular antigen or allergen. This can be self or it can be foreign also. So this inappropriate, either more or either less response can have quite a significant effect on our tissues. It will definitely cause tissue damage. It can also cause tissue death. So this releases inflammatory mediators also, resulting in increased vascular permeability and recruitment of inflammatory factors. So what happens is you have a localized tissue inflammation. So this causes secondary damage also, and these reactions can be in response to certain outside antigens such as pollen in the case of hay fever, or it can be because of the individual's own tissue. So you have a particular test that can be done, that is the gel and the Coombs test. So this has classified the hypersensitivity into 4 types, which is type 1, that is IgE mediated mast cell degranulation. Type 2, antibody dependent cytotoxicity, which is known as ADCC. So this is mediated by killer cells or opsonization. Type 3 is immune complex mediated responses, which helps in activation of phagocytic cells. This again leads to inflammatory response, platelet aggregation, and again you have mast cells coming over and getting activated. And then you have the 4th type, which is the type 4 delayed type, that is cell-mediated hypersensitivity involving release of cytokines from the T cells. So this is C. So when it comes to the type 1, let me just share my screen with you. So when it comes to hypersensitivity, it refers to undesirable immune reactions. So they are either exaggerated or inappropriate towards the self. 4 types: type 1, type 2, type 3, type 4. And type 1, 2, 3 are antibody mediated. Type 4 is cell mediated immunity. So classification by the gel and the Coombs test basically. So you get to see rarely the reactions after this test. It is seen either immediate or it is cytotoxic. Immune complexes are formed. Antigen antibody complexes are immune complexes. And type 4, in this you have the mediators, which is the T cells, because of which it is cell mediated. So type 1 is also called as the allergy basically because of IgG and IgE antibodies. So it is produced by the plasma cells in response to the antigens which are stimulated by the helper cells. So it can be dust, pollens, cosmetics, insects. Insect fur, basically dog fur, cat fur, also cause allergic reactions. Clothing also. Sometimes if you wear clothes which are dusty and all, you will find this hypersensitivity. Or it can be drug reaction. That is, certain people are allergic to certain drugs such as penicillin. So immediately you see this inflammatory response that is kicking in. So this is known as systemic anaphylaxis. That is the term, anaphylaxis, which is important. So it can be, if this one hypersensitivity type 1 is triggered or because of the exposure or ingestion or inhalation or injection or direct contact also. There are a lot of people who have this kind of hypersensitivity type 1 when they are exposed to peanuts also, nuts. Those who have nut allergy also, when they inhale that nut particles also, the type 1 hypersensitivity gets triggered. So it can be systemic anaphylaxis or localized or in that particular tissue or organ. Example is allergic rhinitis. So it is to the nose, and asthma to the lungs. So this is all. And if you see the examples in this, it causes basically the response to the humoral humoral response takes place with the release of the antibody IgE, which binds to Fc receptors on the mast cells and the basophils. They get sensitized. What they do is they start releasing or causing degranulation. Basophils are basically having granules. So this causes degranulation, because of which secondary mediators, which are leukotrienes, cytokines, histamines, vasodilators, vasoactive amines. So all of these are released, because of which there is smooth muscle contraction, increased vascular permeability, vasodilation. So you have a term which is known as atopy, refers to the generation of this particular inappropriate levels of IgE. Examples include allergic conjunctivitis, allergic rhinitis, food allergy, anaphylactic shock, bronchial asthma. When it comes to type 2 hypersensitivity, you get to see that it is cytotoxic in nature. So you have antibodies which are binding to the cells of the tissue antigens. Then IgG and IgM mediate the cytotoxic mediated response against the cell surface and extracellular matrix proteins. So immunoglobulins which are involved in this damage the cells because they activate the complement system. So there is even complement system activation and phagocytosis taking place, because of which what happens is you get to see that there is complement activation which is triggered. So direct damage to the cell surface is taking place. And they can be of two types again. It is complement mediated hypersensitivity, in which what happens is cell membranes, they lead to the complement formation takes place, cascade pathway starts, so lysis of the cell or opsonization takes place. So example is blood transfusion in this particular that is the example. And in the case of antibody dependent cell mediated cytotoxicity, again it involves IgG or GFC receptors only. So it is expressed, because of which NK cells, macrophages, dendritic cells, eosinophils, neutrophils, all of these come into action. They go to the antibody coated target cells. Cell lysis takes place. Again, phagocytosis or complement fixation, because of its release of cytoplasmic granules containing porphyrin granzymes, leading to apoptosis, that is cell death takes place. So examples of type 2 hypersensitivity is erythroblastosis fetalis, and you can get to see autoimmune hemolytic anemia, good pasture syndrome, immune thrombocytopenia, and autoimmune neutropenia. Then when it comes to the type 3 hypersensitivity, you get to see that in this what happens is complements are formed. Antigen and antibody complements are formed basically. In type 3, it's the immune complex hypersensitivity 3 to 10 hours after exposure of the antigen, as in the case of arthros reaction. And what happens is it can be general in as such example is serum sickness, or you have an individual with many organs involved. So again, immune complex mediated injuries can be exogenous or endogenous. And when antigens combine with the antibody within circulation, they form these immune complexes wherever in the body that they are deposited. This triggers the complement pathway. Then polymorphonuclear phagocytes are attracted to that, because of which injury and inflammation is seen. So this is the function wherein type 3 antigens combine with the antibodies. You have the complex formation, because of which phagocytosis takes place and cascade pathway is activated, because of which what happens, neutrophils and polymorphonuclear phagocytes come into place. Inflammatory reaction takes place, the chemicals are released, and it is damaging the underlying blood vessels as well. So all this is there in the type 3 hypersensitivity. Local, in the sense it is arthros reaction, localized. And whereas systemic, example serious sickness or urticaria, arthralgia, eosinophilia, all of these are again systemic reaction wherein the whole body is involved. So let's just see. So you also have immune complex diseases, which are hypersensitivity, pneumonitis, glomerulonephritis, rheumatoid arthritis, and systemic lupus erythematosus. All of these are because of type 3 hypersensitivity itself. And if you see, they are autoimmune in nature. That is, systemic lupus is because of an autoimmune disorder. Rheumatoid arthritis is because of autoimmune disorder. Basically, drug reactions, that is allergies to penicillin, sulfonamides, and infectious diseases such as streptococcus, glomerulonephritis, meningitis, hepatitis, trypanosomiasis. All of these trigger the type 3 hypersensitivity. So this is how it becomes in the case of rheumatoid arthritis. They attack the joints basically. And in systemic, red blood cells and platelets, lymphocytes, muscle cells. Against these, you have autoantibodies. So only you can give steroidal treatment, and this is the basic symptom for a systemic lupus erythematosus. This is this butterfly, rash that is typically seen on the nose and on the right beneath the eyes. And when it comes to type 4 delayed hypersensitivity, you can see that it is commonly called as delayed type hypersensitivity, and it is a function of T lymphocytes. There are no antibodies that are released because of this, and it can start in hours or days and slow after the contact with the antigen, but it goes on for quite some time, that is days also. And it is because of sensitized T cells, and it is not because of serum. So it can be because of mycobacterium, tuberculosis, viruses, fungi, and parasites. So what happens is, in this, the mediated T cells depend on the effector mechanisms, that is involvement of T helper cells and cytotoxic T cells. So once that these are released, antibodies don't play much of a role here. On activation, the T helper cells release the cytokines, so they go start accumulation, because of which the macrophages are involved. And then you have interferons, then tumor necrosis factor, interleukins, all of them come and play a role over here, and macrophage activation takes place. So this is all about the delayed type of hypersensitivity. In the case of autoimmunity, even tuberculin response is a type of delayed hypersensitivity, allergic contact dermatitis, then graft rejection. So different types of grafts are also being mentioned: isograft, allografts, xenografts, and different kinds of type 1, type 2, type 3, type 4, and the comparison has been given here. So this is the references. So when it comes to autoimmune diseases and immunodeficiency diseases, you what happens is, in the autoimmune diseases, you get to see that the body is not able to distinguish between self and non-self, because of which there are autoimmune diseases that are being formed. So autoimmunity is vital, so that you have a normal immune system that is present. So apart from the MHCs and APCs and different kinds of other cells that are involved, usually it is self-tolerant. So if at all this is not working properly, the functioning of the other cells is not taking place, MHCs is not taking place, this causes autoimmunity, wherein the ability to recognize between self and non-self gets reduced. So around 5 to 8% of the population develop these autoimmune diseases. There are more than 80 autoimmune diseases that have been identified, and it is not because of a single specific autoimmune disease, but it is towards antigens either in a tissue or origin. So organ specific autoimmune diseases are Graves disease, Hashimoto's thyroiditis, which affect the thyroid cells, and type 1 diabetes. Then they target the autoantigens, and lesions are restricted to only that particular organ as such, the pancreas in the case of type 1 diabetes. Whereas in non-organ specific autoimmunity, you get to see that it is systemic lupus erythematosus, rheumatoid arthritis, dermatomyositis, all of these. They cause autoantibodies to have a widespread reactivity, and it involves circulating complexes, again immune complexes, IgG and IgM antibodies are involved. Type 3 hypersensitivity comes into place. So let me just share my screen with you. Please give me a moment. So again, in the immunodeficiency diseases, you get to see that you get to see that they were first described in 1950s, around of that time, when the use of biotics and passive immunization started on. So in this case, what happens is it is because of infections by organized organisms that can be eliminated in normal healthy people, but it triggers in other patients wherein there is a kind of immunodeficiency. Your immune system is not functioning against that particular disease. Again, immunodeficiencies are classified into two kinds, that is, what do you call it, the primary and the secondary. In the case of primary immunodeficiencies, what happens is it is because of congenital, that is right from the parents, the disease carrying the gene is present, because of which the child is born with the deficiency. So this is again, there are many types of primary immunodeficiencies are seen. And in the case of secondary, you have it is because of intravenous drug abuse, unsafe or unhealthy sexual activities, risk, other risks involved, malnutrition, chronic diseases such as diabetes. This leads to secondary immunodeficiency and medications and as such. So when it comes to the primary immunodeficiency, what examples are T cell abnormalities as seen in DiGeorge and Viscott-Aldrich syndromes. Then you have lymphoproliferative syndromes, X-linked hyper IgG. Let me see if I don't have. So these are the different kinds of diseases that can come. Chronic granulomatosis disease, hyper IgM, leukocyte adhesions, DiGeorge syndromes, common variable immunodeficiency, IgA deficiency, all of these. So they are congenital in nature. So because of which, what happens is from the parents, the defective gene gets to the child. So in the case of acquired immunodeficiency disease, that is the acquired immunodeficiency syndrome. In this, what happens is it may result from exposure to drugs, chemicals, radiation, or microorganisms as such. So because of which, what exactly happens is AIDS. That is one thing that has come to our attention right now for quite some time, since we have not yet found any kind of medicine against it. I mean medicine in the sense vaccine against it, not a medicine. There are medicines which are they function at the RNA level, and then they try to stop the next cellular proliferation, but other than that, you do not have any kind of other medicines against AIDS right now. And there are other diseases such as cancer or chemotherapy. There is suppression because in the diabetes, as you can see. So all of these are known as actually iatrogenic immunodeficiencies. That is, they are acquired as a result of another clinical condition. So in the case of AIDS, what happens is it is caused by infection with the human immunodeficiency virus. So this binds to the CD4 cells. And in this, what happens is when it binds to the CD4 cells, this requires coreceptors in the form of CXCR4 and CCR5. Then chemokines are also involved. So it is because of a retrovirus, that is human immunodeficiency virus. This has a reverse transcriptase that allows this proviral integration with the host genome that is taking place within the T cells. Then HIV explodes the T cells, because of which all the T cells with the other CD4 cells and HIV virus are traveling in the T cells. So this is one example of the immunological destruction in the case of HIV. There are other cells that are, other conditions in the secondary immunodeficiency disorder, such as multiple myeloma, then immune complex diseases like viral hepatitis, and then you have cancers of the immune systems like the leukemias that are taking place. So all of this is because of the, the secondary immunodeficiencies. So like I said, we have seen about the hypersensitivity reactions, and which are basically inflammatory reactions with the triggering of humoral or cell-mediated immunities against the our own tissues, resulting in damage and death. Then 4 types are there: IG, type 1, type 2, type 3, and type 4, with different kinds of immunoglobulins involved. And in the type 4, that is the delayed hypersensitivity, it is because of the it is because of the T cells and the cytokines that are involved. Now, autoimmunity is wherein, the body's immune system works against its own tissues. This causes a large number of diseases again. Around 80 diseases have been identified so far. And again, they can be either localized or systemic in nature. And when it comes to immunodeficiency diseases, again, there are 2 types, that is primary and then acquired. In the case of primary, it is congenital in nature, that is, it is passed on from the parent to the child. Whereas acquired is because of iatrogenic, that is, because of another clinical condition, or it can be because of various other factors, but definitely not genetic. And so in recent years, you have seen that AIDS has received quite a lot of attention. And then what happens is, in other acquired diseases, it is because of either chemotherapy or radiotherapy. So they are known as iatrogenic immunodeficiencies. So this is all about the hypersensitivity and the immune system in the health and diseases. Now I would like to start with vaccines. So vaccines, when it comes to that, the word vaccine is from the Latin term variole vaccinae, that is cowpox. I'm stopping my screen sharing right now. I will share again. So Edward Jenner was one of the first scientists who had actually, he was the first scientist to he was one of the first scientists to work on what causes these diseases and how can we stop them. So in this particular stream, what he did was, he had discovered the first vaccine, that is to prevent the smallpox in the humans. So he was actually seeing that there was a lot of smallpox in his area. That disease was endemic at that particular point of time, and he saw that whoever was there were milkmaids involved. So the milkmaids who had got cowpox, because of which they were not, or they were immune to the smallpox. So he had understood that there was something in the blood of the milkmaids, or there was something which was different, because of which the people who had cowpox or who were exposed to the cows in that area, they were not getting the smallpox. Instead, it was the other people. So in this manner, he had first discovered and developed the vaccines. Today, vaccine applies to all the biological preparations that has produced from this living organism, so that this is used to enhance the immunity against disease, prevent or treat the diseases. So traditionally, they can be microbes, or virus particles, also microbes, that is bacteria, virus particles. Basically, they can be a part of them. They can be the complete microbes involved, or they can be the killed microbes involved, or only the weakened and microbes. All of these, so that they do not cause a disease as such, but our immune system is able to recognize these parts or these microbes as antigens, as foreign entities, and so that our body is able to produce an antibody response or immune response against that particular microbe. So this immune system confronts these harmless versions of the germs, quickly clears them from the body. First, the immediate immunity comes into place. So then afterwards, you have the adaptive immunity kicking in. So when this weakened or inactivated microorganisms enter the body, they mimic the natural body for infection. So what happens is, this body's response is mimicked. You have a basic response that is taking place, but the memory cells will remember these, so that next time when you are exposed to the same microbe as such, your body is completely able to trigger an immune response immediately. So this is very important for maintaining of the public health, cost effective, safe, and they have led to even elimination of certain diseases such as smallpox and near eradication of polio. Certain places still polio is there, and they provide artificially acquired immunity, easier and much less, in fact, and they can be defined as non-toxic or non-virulent preparation of the antigen material that can be used to induce a long-term humoral or cell-mediated immune response against the pathogens. They are, like I told you, they comprise of the entire organism or a part of it. So again, you have different kinds of vaccinations involved. I will just come to that. So when it comes to the construction of the vaccines, you can see that there are from components of the disease causing organisms. So you take the specific proteins and polysaccharides of the nucleic acids of the microbes. From the living organisms, that is, you cultivate it under optimal conditions, you weaken that organism, and then you genetically modify so that their ability to cause the disease is completely reduced or not there, so that they trigger an immune response from you, but they do not cause the disease in you. So that harmfulness of the disease is reduced. And from whole organisms that have been inactivated by chemical, thermal, or other means. And from linkage or conjugation of the polysaccharides to proteins. This is one way to prepare a vaccine. And from inactivated toxins or the toxin producing bacteria. So only the toxin protein part is taken, or toxin part, which can be proteinaceous, lipid, or for that matter carbohydrate. That part is taken from the toxin producing bacteria instead of the whole bacteria. So it's the bacterial product. Let me share my screen with you again. Right. So types are whole organism vaccines, purified macromolecules, recombinant vaccines, multivalent subunit, and their mechanism. All of this is given. This is the the history and the definition of vaccines. Again, types of vaccines include the killed attenuated in the case of whole organism vaccine, purified macromolecules as vaccines are toxoids from the bacteria, capsular polysaccharides, recombinant microbial surface antigens, then recombinant vaccine and the DNA vaccines and the multivalent subunit vaccines. So we will come to this in a minute. So when it comes to immunization and the childhood vaccination, you get to see that most of us, right from the day we are born, the third day onwards, we are given BCG vaccine, then we are given polio vaccine, then we are given MMR vaccine in the 5th month, then we are given tetanus vaccines, and we have given so many vaccines available. Then we have varicella vaccine against the chickenpox. So this provides, or this is because you are introducing that pathogen into the body, so the next time it comes, the disease, your body is able to fight off the diseases. So in each case, what happens is immunity is either natural, that is transfer from mother to fetus, or by previous infection. This is the natural way of gaining immunity. Second is artificial, that is injection of the antibodies or the vaccines. So in the case of passive immunization, you get to see that protection or alleviation of an existing condition is seen, because of which passive immunization, you have the antibodies are transferred from a donor to a recipient. So it occurs naturally. In the case of maternal antibodies, they cross the placenta so that they go into the developing fetus. These maternal antibodies provide protection against mumps, diphtheria, rubella, tetanus, poliovirus, streptococci. All of these you get passively acquired protection to the fetus. They also are present in colostrum and milk, so that they provide passive immunity to the infant. And it can also be achieved by injecting a recipient with the performed antibodies. So you have vaccines and antibiotics also available in the case of passive immunization. And so you can either give but there are certain risks involved. So that is because of the side effects that are seen because of it, or because of this passive immunization. You also have the active immunization, in which what happens is you have protective immunity and an immunological memory. So the memory cells are involved in this. So what happens is, if it is successful, this is because the next time whenever the body is exposed to that particular pathogen, then it elicits a heightened immune response against that particular pathogen. Again, active immunization can be achieved by natural infection with that microorganism, or by artificially you administer that particular pathogen by a vaccine. So in this active immunization, immune system plays an active role. So you have antigen reactive T cells, B cells coming into place, and you have the memory cells playing a role. And then you have, because of all this, what happens is you have a reduction in the number of people who are getting infected. At the same time, number of people who are getting who are dying because of this particular infectious diseases, especially the children who are vulnerable and who do not have prior antigen contact with this particular pathogens, or for that matter prior infections. So their immune system as it is weak and developing, because of which there is a chance for them to be highly disabled because of these particular pathogens. So vaccination starts from about 2 months of age. Actually, not from 2 months, right from the third day of the birth, basically, that is when you get your BCG vaccine that is given. So in the case of childhood vaccinations, you have a schedule that is followed. So the different kinds of vaccines that are given is hepatitis B, that is from 1 to 2 months, in fact, followed by third dose at 6 to 18 months, in fact. So you have a primary dose and you have a booster dose as well. You have a rotavirus vaccine at around 2, 4 months and 6 months that is given. Then Haemophilus influenzae B. Right now you have a polyvalent or a multivalent vaccine. You have 4 or 5 uh, vaccines combined together. So that vaccine is given, and that shot is given at a time, basically. And then you have a poliovirus vaccine, which is given at ages 2, 4, 6, 18 months, and between 4 to 6 years. And again, after 12 years, you can get a booster shot. Then you have the DPT vaccine, which is very important. Before the age of 7, it should be given. That is against the diphtheria, pertussis, and tetanus vaccines. Again, different kinds of age, the levels it is given with. So you have a vaccine sheet, which is very important, that if at all, you should keep it for lifelong. It will serve a purpose. And you have vaccines for meningococcal diseases, and for against influenza, you can get a booster dose also. Then MMR vaccine, that is from 12 to 15 months, and then 4 to 6 years it is given. And varicella vaccine, that is against the chickenpox, hepatitis A vaccine, and the HPV vaccine. And then that's what. And even the girls are advised to have the vaccine against the cervical cancer also, so that it will be useful for them. So when it comes to the different types of vaccines, again, like I told you, it can be of 4 types. That is live attenuated vaccines, and that is the whole organism vaccines. Then you have the inactivated vaccines, that is purified macromolecules. And then you have the DNA vaccines, and then you have the multivalent subunit vaccines. So when it comes to the whole organism vaccines, that is, live attenuated, the whole organism is used as such. And it is heat kill, destroyed by chemicals, heat, radioactivity, or antibiotics. And it can be attenuated also, that is weakened in conditions, so that, their virulency comes down. So examples of this vaccines are, for example, attenuated strain of Mycobacterium bovis, which is known as BCG, that is the Bacillus calmette-guerin vaccine, was developed, and Sabin's polio vaccine, and then the measles vaccine. So you have BCG vaccine, MMR vaccine, rotavirus vaccine, chickenpox vaccine, that is the varicella zoster vaccine. All of these are live attenuated vaccines, that is with the whole organism involved. So again, they have given here inactivated and whole organisms, different kinds of common vaccines. So when it comes to the inactivated vaccine, what happens is the pathogen or the microbes are heat killed, and chemicals are with help of either heat or chemicals, so that it can no longer replicate inside a host. So the epitope structure in that vaccine is maintained even despite it gets inactivated. At the same time, this inactivated vaccines use the killed version vaccine so that they protect us against the disease. They don't provide much of immunity because as strong as the live ones basically, but you need several doses. So you need booster shots for that in order to get the immunity against that particular disease. So example is the inactivated polio vaccine or the IPV and the hepatitis A vaccine. You have the cholera inactivated vaccine or DPT, that is pertussis inactivated vaccine. But these are live attenuated. Tuberculosis and typhoid, you have already seen that. All of these are inactivated or live attenuated. Sabin's polio vaccine is live attenuated. Salk's vaccine is again inactivated. So you have different kinds of polio vaccines also. Varicella zoster is live attenuated. Rabies is inactivated. So for inactivated vaccines, you need booster shots. When it comes to purified macromolecules as vaccines, so what happens is there are certain risks involved with attenuated or killed whole organism vaccines. So the general forms of this purified macromolecules are inactivated exotoxins, capsular polysaccharides, recombinant microbial surfaces, or that is a subunit in the conjugate forms, and recombinant microbial antigens or the surface antigens. So in the case of subunit or conjugated vaccines, only the pathogens that the pieces of the vaccine is of that particular pathogen is used, and it will be only so that the target pathogen can provoke and or invoke an immune system response. We do not want more than that. Example is pertussis vaccine and influenza vaccine. Conjugate vaccines are made using pieces from the coats of the bacteria basically. So what happens is in the case of the conjugate vaccines, you have this helps in getting or evoking a powerful immune response. Examples are HIV vaccine and the MenC vaccine, which contains the polysaccharides which are joined to the tetanus toxide. And then you have the PCV vaccine, that is the pneumococcal vaccine. This contains the polysaccharides from the surface of the bacteria, so that pneumococcal disease is because of that. And this is joined to the diphtheria vaccine, because of which you have protection against both pneumococcal diseases as well as the diphtheria. And then you also have the MenACWYW, that is polysaccharide vaccines from different kinds of bacteria, basically 4 different types of bacteria that are involved, because of which what happens is this called, you get protection against meningococcal diseases, diphtheria, as well as tetanus toxoid at the same time. I would like to finish this lesson, so another 10 minutes of your time, please. Polysaccharide vaccines, what happens is in the case of polysaccharide vaccines, you get to see that the coating or the capsule of the bacteria has this antiphagocytic properties. It's because of the hydrophilic polysaccharide capsule. So this coating is taken, and along with another complement, this increases the ability for the macrophages and the neutrophils to come trigger the complement pathway, and then phagocytosis takes place, removal of the pathogen will take place. So example is the Streptococcus pneumoniae, which is the Nemax vaccine, and the vaccine for Neisseria meningitis, which is a bacterial meningitis. So you have purified capsular proteins against this. You also have the toxoid proteins. In the case of toxoid proteins, what happens is this is because the toxin itself is, very harmful. So because of which, what happens is only the toxins, they themselves, are causing the harm. So that is taken to create an immunity against the particular pathogen. So either the inactivated, that is exotoxins, or endotoxins. It can be the exotoxins basically. So what happens is inactivated, heat killed, or chemical treated so that it gets totally inactivated. These vaccines are taken. They are used to build the immunity against that particular toxin. You don't need the bacteria that is going to produce this particular toxin. Example is botulinum antitoxin and diphtheria antitoxin. So these are made by purifying the exotoxin, then inactivating the toxin with formaldehyde to form a toxoid. Then vaccination with the toxoid induces the anti-toxoid antibodies